I shall be talking on foot care in diabetes. As you know, diabetes is a diabetes is a multi-system disorder, and it affects all the important organs of the body like retina, kidneys, brain, cardiovascular system, and even the nerves and the arteries going down to lower limbs, and thus affecting the feet. Next. You'll be surprised that the burden of diabetic foot is enormous. Diabetics are 40 times more likely to lose a leg as compared to non-diabetics. 75% of all leg amputations happen in people with diabetes. People lose a leg every year due to diabetes. So you can judge the problem or the magnitude of the problem. Next. Every 30 seconds, a leg is lost somewhere in the world due to diabetes. Next. In India, things are not different. Rough estimates indicate that about 100,000 legs are being amputated every year in India related to diabetes. Next. If we look at the problem, diabetes affects feet in two ways. One, by affecting the several nerves that supply the feet, causing neuropathy, and next, by affecting the blood vessels which supply the lower limb and the feet, and there occurs obstruction and therefore reduced blood supply to feet, causing another foot problem. So diabetic foot, the two most important causes are neuropathy and vascular disease. Next. And therefore we have two types of foot problem. Neuropathic foot, where neuropathy is dominant, and we call it neuroischemic foot, where ischemia or less blood supply to feet is the dominant factor. Next. Basically, the neuropathy which affects feet in diabetes is bilateral, it is symmetrical, and it is irreversible. So both feet are equally affected. The sensations are lost for good. By no treatment you can have any recovery as far as the sensory loss is concerned. So it's bilateral, symmetrical, irreversible neuropathy affecting feet. Next. We have some of the most important protective sensations that the God has given to us for feet, and they are touch, pain, and temperature. It is said that this is the best gift God has given to us, but we do not realize the importance of these sensations unless or until they are lost. And you can see the disasters that can occur with the loss of these protective sensations. Next. And the symptoms of this neuropathy, usually patients complain of burning in the feet, tingling and numbness, pain in the calf, and this pain or burning is especially more so when they go to bed. So it's more exacerbated in the night. Next. With diabetes, we have basically three types of nerves which supply the feet. One, the motor nerves, sensory nerves which carry the sensations, and the autonomic nerves. Now all these three nerves in diabetes are affected equally, and loss of motor nerves leads to atrophy of the small muscles of the feet. That leads to toe deformities. Loss of sensory nerves lead to loss of protective sensations, for example, pain, touch and temperature. And loss of autonomic nerves lead to very important function that we have is sweating. Our feet are always moist, but when autonomic nerves are damaged, there is lack of sweating and therefore the feet become dry. And once the feet become dry, they are susceptible for cracks and fissures. Next. And this is how the neuropathic feet look like. You can see the atrophy of the small muscles. You can see the tendons becoming very prominent because of loss of or atrophy of the muscles in between these tendons. And because of this atrophy of the muscles, the toes become deformed and there is clawing of the toes. And you can see the deformed toes, both feet, it's symmetrical. Next. This is advanced case of neuropathic feet. You can see again the clawing of the toes. And then underneath this clawing or deformed feet, callus develops. This is a callus which develops because of increased pressure under these bony prominences. These calluses develop wherever the pressure, plantar pressure is more. Like the tips of the toes, you can see the first metatarsal head. The patient has already lost the both great toes, and they would occur wherever there is increased plantar pressure. You can also appreciate the dryness of the feet. Next. So in short, neuropathy leads to loss of protective sensations and therefore these feet become at risk of any injury because they have lost the protection. Next. Now this end result of this neuropathy is of course the ulceration of the feet, and this neuropathic ulcer are caused because of two mechanisms. One, the extrinsic mechanism we call it, and in extrinsic factors we have ill-fitting footwear or improper footwear, accidents, falls, objects inside the shoes, thermal trauma because of loss of temperature sensations. Patients cannot appreciate the hot or cold temperature and therefore are susceptible for damage, and that injury is called thermal trauma. And injury due to sharp objects. Some of our patients walk barefoot and they are with loss of protective sensations, their feet become vulnerable for injuries due to sharp objects. And because there is no pain, patients tend to do home surgery. They use blades, unsterile instruments and try to nibble or cut some of the calluses without realizing what harm they are causing to their feet. Next. And this is how I'll explain the extrinsic factors operating. For example, ill-fitting footwear. You can see the damage it has caused to neuropathic feet. Next. Or the footwear which has lost total shape but is still being used. Because patients have no sensations, they can walk with any type of shoe even if it is tight. You can see the footwear is totally deformed, but patient is still wearing. This footwear can lead to severe injury to the feet. Next. And as I said, objects inside the footwear. We do not realize with loss of protective sensations, patients can walk with objects inside the footwear. You can imagine when you walk with your shoes, and even if there is a sand particle, you cannot walk even for 2 steps. The pain is so severe. You have to take out your footwear and take out the sand particle or whatever foreign object which has entered your shoe. But these people with loss of protective sensations can walk, attend whole office for 8 hours and come back with a swollen foot. Because we have children at home and these children tend to put everything that they see on the floor into the shoes. And if it happens to be a shoe of a diabetic who has lost protective sensation, it can be very damaging. Next. Thermal trauma. With the loss of protective sensations, they cannot appreciate hot surface. And in India, some of our patients who are very religious walk barefoot in summer months when the temperature is 45 degrees, barefoot going visiting temples, and when they return they have such burns over the plantar aspect of their feet, and this is after debridement of these blisters. You can see the entire weight bearing area of the foot is affected. Next. Another patient, you can see the thermal trauma. This patient was using that hot water bottle he had kept on his dorsum of the foot because of some uneasiness, and he kept on watching the television news without realizing the hot water bottle causing thermal trauma, and when he visited us it had such a large hemorrhagic blister or bulla over the dorsum of the foot. Next. Some of our patients who go on a motorbike barefoot or using such unprotected footwear, if they have no sensations, they can even rest their feet on silencer pipe because they don't appreciate any hot temperature. And you can imagine what will happen to this foot if it is kept in contact with a hot silencer pipe for 20-30 minutes. Next. And this is what it happened. Both the feet coming in surface with hot silencer pipe or any other objects of the motorbike, and you can see the injury that it has caused. Next. When they walk barefoot, they are susceptible for sharp injuries. You can see the injury because of the glass prick injuries, stone pricking, etc. Next. And of course the home surgery. Next. There are intrinsic factors which also can lead to foot ulceration, and these are because of limited joint mobility, bony prominences. As I said, there are deformities and therefore there are bony prominences. The deformities lead to increased plantar pressure and callus develops underneath the increased plantar pressure, and as the neuropathy advances, even the joints are damaged, leading to Charcot foot or neuroarthropathy, and there are fissures and cracks due to lack of sweating and dryness of the feet. Next. And this is what happens, the pressure points develop wherever the plantar pressure is increased. The foot becomes deformed, and you can appreciate the weight bearing area of the foot is reduced because of the bony prominences, and these are the vulnerable sites, especially forefeet, underneath the toes or heads of metatarsal where the ulceration begins. Next. And this is the quantitative analysis on computers, and you can see the red areas which are high plantar pressure areas. Next. And this is the clawing of the toes, and you can see the sites which are at risk like tips of the toes or on the dorsal aspect of the toes where bunions can occur. Next. And such deformed toes get crumbled inside the normal footwear, and therefore patients tend to get injury or ulceration either on the plantar aspect or on the dorsal aspect. Next. Some of these patients develop, you can see the bunion because of the deformities, and appreciate these deformities, hallux valgus deformity, and this these feet are difficult to accommodate in a normal footwear because of abnormal shape, and these are the sites where the feet get ulcerated. Next. And at the pressure points the callus develops, and this callus is a danger signal. It's a precursor of a foot ulcer, or sometimes it covers the existing foot ulcer, as you can see here. Next. These calluses, whenever are seen, have to be trimmed regularly in our clinics by paramedical staff or trained podiatrist. If the callus is regularly trimmed, you can reduce the plantar pressure at that site by 30%, and you can prevent the risk of foot ulceration. Next. And as I said, with the loss of autonomic nerves, the feet become very dry and they are susceptible for cracks and fissures. You can see the deep fissures over the plantar aspect, and once these fissures are so deep that they start bleeding and they pave way for bacteria to enter and create a limb threatening infection. Next. And I said, as the neuropathy progresses, even the joints get involved, and you can see the entire foot is now deformed. The ankle joint, the tarsal joints are all affected, and the shape of the foot is totally altered. And if you take the X-ray, you can see the tarsal bones are totally disorganized, metatarsal joints are damaged, and there is absorption of the bones because of osteoporosis. Next. Some of these patients, especially Indian climate, are susceptible for fungal infections. So we should always make it a point to examine the feet and also examine the web space, in space between the two toes, for any presence of fungal infection. Next. These patients with neuropathy or ischemia also have very thick deformed nails, as you can see, and these thick deformed nails are dangerous for the patient because it increases the thickness of the toes, and they are so crooked that they can pierce in the soft tissue and create injury. These nails are difficult to cut by patient because most of the patients are obese, have vision problems, and they cannot bend to that extent, and even if they manage to bend, these nails are so thick that they cannot. So our paramedical staff should be trained to trim the nails effectively. As you can see here. Next, with the nail clipper, the nails are regularly trimmed. Next, and you can see after trimming, you can see the debris or after removal. So you are preventing